good morning to all our esteemed faculty members, and thank you for joining us for this Wednesday's morning breakfast at UMHealth. My name is Anjanna, and I'm one of the infectious diseases physicians here at University Malaya. I'll be moderating the first talk for today's session. Dengue remains a public health challenge and, importantly, a disease of urbanization. And in areas like ours, like in Petaling Jaya and Kuala Lumpur, where densely populated environments create ideal conditions for its spread, we continue to combat dengue. There's an evolving landscape of prevention now that offers new hope, especially with the recent introduction of the dengue vaccination. It is an absolute honor and pleasure to welcome our distinguished speaker, Associate Professor Dr. Sharifah Faridah Syed Omar, consultant in infectious diseases and head of infectious diseases unit at University Malaya. Prof. Sharifah is deeply involved in dengue advocacy and research and serves as an international subject matter expert for the dengue vaccine, as well as a panelist and expert advisor for the National Dengue Mortality Meetings. She's undoubtedly the best person to shed light on today's topic, dengue in Malaysia, evolving trends and advances in prevention. During the talk, if you have any questions, please submit them via the Q&A box and we will try to address them at the end of the session. Without further ado, please join me in welcoming Prof. Sharifah.
So I'll be talking about the trends of dengue infection in Malaysia and also globally, and talk a little bit about the dengue vaccine that has just been released in recent years. So just to recap, what dengue is a type of arbovirus, and it's one of the most prevalent arboviral disease, causing up to hundreds of acute illness. May be difficult to differentiate one from the other. And in order to differentiate or help diagnose, clinicians should be aware of the epidemiology, clinical manifestation, and diagnostic tests that can help differentiate one from the other. So it's typically transmitted in tropical and subtropical climates, and mostly in urban and semi-urban areas. And the primary vectors are the Aedes aegypti and Aedes albopictus mosquitoes. So I'm sure all of you are aware there are 4 serotypes, though some may argue that each serotype sometimes behave like different viruses. And infections with one serotype provides long-term immunity with the same serotype and only transient immunity with the other serotype. So there's also this pathophysiology of secondary infections with a different serotype usually or may increase the risk of severe dengue. So dengue is a significant global and national public health causes a significant public health threat. And this is a map from WHO showing the geographical distribution of dengue as reported by WHO in 2024. And those that are in the darker blue colors tells you countries that have high number of dengue cases. And this is mainly in Southeast Asia, Asia Pacific, and also the Americas. But you can see also lighter blue colors further up beyond the tropic and subtropic countries. So it is transmitted in a lot of countries, at least more than 100 countries worldwide, and putting half of the world's population at risk of dengue. And the number has actually increased dramatically over the past 50 years. And each year it causes up to 100 million infections, half a million hospitalization, and more than 20,000 deaths worldwide. And this is a graph showing you the 3 regions, WHO regions most affected with dengue, being the Pan America, Southeast Asia, and Western Pacific countries. So the rise in number of cases, especially in the Americas, is quite alarming. So this is a very old graph, but I like this graph because it shows you the dramatic increase. So dengue has been around for many, many decades. Even in the 50s, there were cases of dengue. But this number has just grown exponentially from the 70s onwards. And this could be contributed by, better reporting, better diagnostics, and so on. But this also reflects the true increase in number of infections worldwide. But what's more alarming, equally alarming, is that the having of for that I the UMHealth. So they're making it difficult to reduce or stop the transmission of dengue in a population. So this is a systematic review and meta-analysis looking at the global of dengue outbreaks in the past 20 years from 1990 to 2015. And we'll be focusing on the epidemiology from this paper. So there were almost 250 articles that were retrieved with 260 outbreaks and almost 300,000 cases of dengue. But what's alarming is that more than 40% of the outbreaks occurred in the last 10 years of the review from 2010 to 2015. And it also accounted for more than 70% of cases. So even though this is a limited report, just looking at countries or outbreaks that have been published, but it is still equally alarming because you can see that not only are the number of outbreaks increasing per year, but the number of cases involved is also increasing. So most of the countries or areas that is affected, Western Pacific, Southeast Asia, and America account for more than 80% of the outbreaks. And Southeast Asia used to be the area with most cases, with Western Pacific as well. But as you can see, the Americas, especially in the past 5 to 10 years, number of cases from the Americas have also increased dramatically. And in this particular review, the 3 countries that had the most number of cases were India, China, and Brazil. One of the things that they found is that after 2010, patients were significantly older compared to before 2010. However, rates of dengue hemorrhagic fever, the most severe form of dengue, secondary infection and mortality actually decreased after 2010, which may reflect the improvement in terms of case management of dengue patients. Mortality rate was significantly correlated with dengue hemorrhagic fever, but not with the rate of secondary infection. So it is a problem globally. What we are seeing is actually just the tip of the iceberg, which makes transmission difficult to control. We are in an area with the highest burden of disease. And on top of that, because of the alarming number of cases, dengue is one of the diseases that can constitute a public health emergency of national concern. I think a lot of us are very familiar with this theme. Hello? Something? Okay. I think a lot of us are very familiar with this PHEIC, especially with COVID, that in the pandemic that we had just gone through recently. So it shows you the urgency of the number of cases of dengue. And true enough, in December 2023, WHO did declare dengue as one of a disease which required major to maximal WHO response. So it upgraded to grade 3. So post-COVID is when we suddenly saw a huge number of cases. So you are seeing a lot of, for example, news outlets reporting a spike in number of cases. So the left being one in Malaysia and the right from Reuters, which tells us about the alarming increasing of cases, which is probably related to global warming phenomenon. And this is graphs showing the global trends in annual reported dengue cases from the WHO. And you can see that just pre-COVID, the number were already very high and quite alarming. In 2019, number came down a little bit during COVID, but has spiked again, especially in the past 2 years, 2023 and 2024. What's happened in Malaysia? So prior to 2014, cases have been between 20 to 60,000. But since 2014, we have actually multiple times surpassed the number of 100,000 cases per year, with 2019 being the highest peak. And this is not just because this is a true reflection of the increased number of cases, because prior to 2014 or even earlier than that, reporting was done if there was a suspected case or there's a clinically diagnosed dengue fever. But at some point, reporting was only done when there is a positive NS1 test, for example, or serology test, which confirms the diagnosis of dengue. So not only the reporting involves patients who are confirmed to have dengue, but so therefore this is a true reflection of an increased number of cases over the years. And 2019, as mentioned previously, was the year that we had the highest number of cases. 2023, post-COVID, we thought that we would surpass this number, but we just reached about 120,000 cases. And 2024, there was almost equal number of cases of dengue of more than 120,000. And but the number of deaths were a little bit more compared to 2023, thus increasing the case fatality ratio from about 0.08 to 0.09. So one of the reasons that this case fatality rate could have gone up is because post-dengue, post-COVID, there was a surge in serotype 4 in Malaysia. Malaysia is hyper-endemic for dengue. We have all 4 serotypes circulating amongst the Malaysian population. So during COVID, there wasn't much cases. There were a lot of non-immune cases, non-immune patients or person walking around, and then they get infected with serotype 4. And then at the end of 2022 or towards the end of 2022, there was a rise in serotype 2, the red line here. And this serotype switch could be the reason why there was equally numbers, high numbers of cases in 2023 and 2024. And as you know, 2020, serotype 2 is often associated with more severe cases of dengue. Thus could be the reason why the case fatality rate has gone up as well. So dengue commonly affects individuals between the ages of 10 to 39 in Malaysia. And over the years, I think with better clinical management, the incidence of dengue hemorrhagic fever has decreased in all age groups. And this is a good sign, but we still have a lot of number of cases in mainly the population between 10 to 39 years old. So as mentioned earlier, 3 regions most affected are the Americas, Southeast Asia, and Western Pacific region. But we are seeing new cases in areas that had no dengue before. For example, Europe. Africa is known to have dengue, but is underreported. So 2019 saw lots of countries in Southeast Asia with cases more than 100,000, more than 400,000 in the Philippines, and more than 300,000 in Vietnam. As I said, there was a decline in cases during COVID in our country and most other countries, except for a few. For example, Singapore actually saw a rise in number of cases, and there could be other reasons for that. And because of this low number of cases, there was an accumulation of people without immunity to certain dengue serotype. And this puts them at risk of another secondary infection when another serotype, when there is a serotype switch. So we often see transmission being cyclic with large outbreaks expected every 3 to 4 years. So with the high numbers in 2019, so post-COVID, the whole world was actually prepared in a way. Well, not prepared, but expecting another outbreak. And sure enough, this happened in 2023. Where worldwide there was more than 6 million cases. The Americas being most affected, but there was also equally high numbers in Asia as well. 2024 also saw a higher number worldwide. So even in Malaysia, the numbers were fairly equal, 2023, 2024, but worldwide, the number actually doubled, especially in the Americas. So in the first 4 months of the year, they had exceeded 7 million cases. And on top of that, there was also autochthonous or locally transmitted dengue infection in WHO European regions. So it's going beyond the traditional regions of WHO that's most affected with dengue. So these are the various factors that have been identified to increase the risk and of spread of the dengue epidemic. For example, changing distribution of the vectors, climate changes, changes in the circulating serotypes and serotype switch that I was mentioning about earlier. And let's not forget, post-COVID, we have a very fragile health system, which probably couldn't afford or finds it difficult to cope with another outbreak. There were also other factors, including political and financial instability, and transmission seasons appear to be much longer than it used to be before. And people are starting to move again. And on top of that, mosquitoes are also being carried from one country to another country as trade increases. Surveillance system is paramount in any communicable diseases, and unfortunately dengue has, the surveillance system may not be as good as we would like it to be. So there's this interconnection of global issues, and this may lead to a complex environment that exacerbates the challenges in managing communicable diseases. For example, dengue, which is often seen in urban populations, they may be more vulnerable to this vector-borne disease due to the climate changes. And at the same time, especially the urban poor face challenges due to the inadequate health infrastructure. So there are many, many prevention strategies that we can talk about. But for example, how do you prevent the vectors, transmission, infection, and also talking about preventing severe dengue in terms of case management. But what and the WHO and also Malaysia government has put some targets for us to try and reach. For example, WHO targets to reduce dengue case fatality rate to 0% by 2030. Malaysia, over the years, has always maintained a fatality rate of less than 0.2, often less than 0.1%. But on top of that, we would also try, to reduce the dengue percent. So in order to do this, we have to acknowledge dengue as a collective threat, a global, collaborative, comprehensive, multi-sectoral, and integrated management strategy is required to achieve targets. So these are some of the responses from WHO that they have taken using their network of laboratories, collaborating centers, and they provide or support member countries by doing things like helping them to confirm outbreaks, helping them to manage outbreaks, helping them to improve reporting systems so that we know the true burden of the disease, train in clinical management, diagnosis, vector control, looking for evidence-based strategies and policies, developing dengue prevention and control strategies, reviewing any new tools that might be helpful in dengue control, and also publishing guidelines and so on. They've actually created this dashboard. This is to help strengthen global surveillance and monitor temporal trends and disease incidents. So this is accessible through this website written here. So it gives you a snapshot of what the dengue situation is, for example, number of cases, severe cases, confirmed cases, but bearing in mind that it only captures about 100 countries, and 20 have zero reporting countries. So surveillance reporting is still lacking when it comes to dengue. Dengue is one of the diseases considered a neglected tropical disease, and from this WHO document 2030 roadmap, it is one of the diseases that is targeted to either be eliminated or at least reduce in its severity and impact on the global community. And recently in October, the WHO released a strategic preparedness, readiness, and response plan, which aims to reduce the burden of disease, suffering, and death from dengue and other Aedes-borne arboviral diseases. So in order to prevent or control dengue, if you like, one of the models is to use this integrated management strategy for dengue prevention and control. And this model aims to reduce morbidity, mortality, and also the social and economic burden generated by dengue outbreaks and epidemics. So it includes epidemiology, integrated vector management, environment, patient care, which we are most associated with in the hospital, laboratory as well, and also talk about vaccines as well. So in Malaysia, what do we have? Our public health sector has produced lots of strategic planning. We have platforms, we have dashboards as well. The community is also involved in terms of forming the committee, and also there is also this Wolbachia mosquito release. Fogging is still ongoing, and also this platform of reporting. On the clinical side, we have the CPG. We are in the midst of updating the adult CPG as we speak, and also lots of training to try and help our physicians as well. This one. Okay. So what's missing is vaccine. So having vaccines available may complement the nation's strategies to implement management strategy to try and reduce the burden of dengue on our countries. And vaccine is an essential part of this integrated dengue control and management platform. And WHO has also recommended that the vaccine, once available, should be introduced in national strategies. So just to hop on quickly to the dengue vaccine that is currently available in the country since last year. So this is the study, the third phase 3 clinical randomized control trial that was done, which is the platform of how this vaccine became available or approved to be used in Malaysia. So it involved more than 20,000 children between the ages of 4 to 16 years old, mainly in 8 endemic countries in Americas and also in Southeast Asia. And the follow-up period is up to more than 4 years, looking at the overall efficacy, looking at the secondary endpoints based on serotype, baseline serostatus and severity, and also looking at hospitalization, long-term efficacy and safety. And there's also a booster arm, which is still in progress. So in a nutshell, in terms of long-term protective efficacy against virologically confirmed dengue, regardless of the baseline serostatus. So that the dotted lines basically show patients people who receive the vaccine, and the straight line is those who receive the placebo. So the efficacy primary endpoint was about 80% at 12 months, vaccine efficacy for those who received the vaccine, and dropped a little bit to 73%. At 18 months, and further dropped to about 60% at 4.5 years. So that is protective efficacy against infection, and this separates out quite early on and is sustained up to 4.5 years. In terms of hospitalization, we see the same effect between those who receive the vaccine and those who receive the placebo, with higher efficacy against hospitalization, 90% at 18 months and 85% at 4.5 years. So vaccines became available in Malaysia, as shown here. But the introduction of vaccine in Malaysia, the DCA granted conditional approval, meaning that they wanted a registry for all people who were administered the TAC 003 vaccine. And on top of that, is part of this active surveillance, which is a voluntary active surveillance for patients who receive the vaccine. So the point of having these two registry is, one, to provide some real world data for the vaccine. So the registry is a passive one where everyone needs to be on the registry, while the Act to Care active surveillance is a voluntary survey which collects data until 15 months after the first dose. So this is a pamphlet. So if any of you do go forward to take the dengue vaccine, do try to enroll yourself into this active surveillance. And the investigators are from and also UPM. So the hope is that by doing the mandatory registry and also this active surveillance would help healthcare providers, will help inform healthcare providers, and also boost public confidence as well. So in conclusion, dengue is the commonest arboviral disease worldwide, and transmission is sustained through an interplay between the virus, host, and vector. We saw a surge of cases post-COVID-19, including in our region, and an integrated management strategy must be adopted to tackle this disease. The introduction of dengue vaccines will hopefully have an impact on the dengue landscape. Obviously, there are other dengue vaccines, but this is the one that's currently in the market. And unfortunately, I don't have enough time to talk about the other dengue vaccines. So before I end, just a shout out to two workshops that the ID unit are having in February. One is a tropical medicine workshop on the 22nd of February, and the other one is the HIV updates also in February. And should you be interested, do email our executive assistant, Clara, at her email here. Thank you. Option. All right. Okay. Okay, so I think we have a few questions that we will try to address. Why was the use of mosquito nets discontinued to prevent patients with active disease, presence of high proportion of asymptomatic cases? From Prof. Chan. I think basically it's not really done in dengue because most of the time, by the time patient comes to the ward, they are no longer viremic, so maybe it may not be very useful in a way to use mosquito nets in the hospital settings, but it's not something that is advocated either at homes. Mosquitoes usually bite at dawn and dusk. I suppose you could use it at home, but it's not one of the measures that is used to control the vector. During dry season, cases rise, presumably with a faster maturation, which is good with a higher temperature. That's right. So dry season, rainy season, both times, we always associate dengue with the rainy season because there's just more places for the mosquitoes to lay their eggs and the mosquito population increases. But you're absolutely correct. During the dry seasons, they actually mature much faster. So even if the population is not as big during the wet seasons, but they do mature quite faster, and therefore the turnaround is much bigger as well. So the last question is about the Wolbachia, I think. So strategy to reduce the mosquito population with the introduction of bacteria to terminate their population. So this is the Wolbachia mosquitoes. So this is another lecture on its own, but suffice to say that it does work, but it requires a lot of money and it has to be repeated from time to time. And there's two strategies to it, depending on which strategy you would use. But it is effective, but to sustain it may be a bit difficult. So there's a lot of, for example, there's this World Mosquito Program that is happening to help lower and middle income countries to be part of the Wolbachia project to reduce the population of the mosquitoes, but it does work. And I think Malaysia is restarting the program as well, but it does work. Okay, I think that's it. Yeah. All right. Anything else? Okay. So I'll say here. Once again, thank you so much for staying on. Again, apologies for the technical issues. I hope we are all aware of the dengue problem, and hopefully we'll see a better future with the introduction of vaccines and continuation of the other measures to control dengue. Thank you.